you can introduce yourself a little further. But she's one of our master students here at DGHI in Global Health. And she's going to share some of her work that's about cancer care for children and treatment abandonment, which I'm sure if you're not familiar with what that is, she will explain it to us. So without further ado, we'll turn it over to Yuuna to present. Welcome.
Thank you. Is it okay if I share my screen, or could someone give me access for that?
Yeah, you can try. Try now.
Can everyone see my screen?
Yeah.
Okay. Perfect. Okay. Hi everyone. As I was just introduced, I'm Yuuna Mira. I am a first-year global health master's student at Duke, and I'm also working under Dr. Emily Smith. I just want to thank you guys for this opportunity to present my thesis proposal to you guys, and I would love to hear feedback about my project, any thoughts, and then questions if you guys have any. So yeah, my research title is Understanding Abandonment of Cancer Care, Analyzing Clinical and Demographic Factors and Quantifying the Cost of Cancer Care for Children in Tanzania to examine associations with treatment abandonments. Okay. So yeah, I just kind of want to first start off with the background information to ground my topic in general. So as each year, around 400,000 children around the world develop cancer, with only 30% of these children being cured in low and middle income countries compared to the 80% of those in high income countries. So there's a large disparity here. And additionally, 84% of the 11.1 million children who experience cancer attributable death live in LMICs, underscoring the inequities in cancer outcomes. And one of these reasons, as stated before, is abandonment of cancer care. So what is abandonment of cancer care? So it is defined as failure to initiate or complete a treatment of at least 4 weeks due to non-medical reasons, which disproportionately affects LMICs overall. And this is a very large preventable factor in childhood cancer. And the reasoning for abandonment of care can be due to many reasons, and this can be risk factors such as poverty or out-of-pocket expenditures, as seen in some previous literature. And the WHO Global Initiative for Childhood Cancer has set a 60% 5-year survival for children with cancer by 2030. But there's still a lot of gaps in literature of risk factors related to abandonment of care. And as of this, researchers are then unable to kind of properly estimate the disparities that exist in care. So my research topic can be critical to kind of address this gap and can also perhaps inform future evidence-based interventions. And I also want to talk about my research, how it will be focused in Tanzania, which is an LMIC in East Africa. Tanzania has 3 tertiary level centers with cancer care capacity, with one of it being in Moshi. And there's also only one pediatric oncologist in Moshi. KCMC is a zonal referral consultant hospital for the northern regions of Tanzania, and more than 60% of their patients travel from different regions of Tanzania to KCMC. And conventional chemotherapy is offered at KCMC. However, radiotherapy is not, forcing families to travel to other cities such as Dar es Salaam to receive treatment. And although all direct medical expenses and indirect expenses such as food or transportation are covered by KCMC during their care, so there's no cost to the families after kind of getting to the hospital, but there is still, it's important to note that abandonment of cancer care still exists. So my research will be kind of focusing on identifying different risk factors to this abandonment of care. So, my research question overall is among children with cancer ages 0 to 19 years old at diagnosis in Tanzania who received cancer care at Kilimanjaro Christian Medical Center, KCMC, in the last 9 years, how do demographic, clinical, and the cost of cancer care influence abandonment of cancer care compared to children who continued care? And my focus is around the last 9 years because that is when the cancer registry kind of was started. And I broke down my aim into two aims, or my research question into two aims. So, aim one will be identifying the patient's clinical or demographic factors that impact abandonment of surgical care, cancer care at KCMC. And aim two is quantifying out of pocket costs for families of patients who were referred out for radiotherapy and investigating whether the family abandoned care. So, my research design overall is a retrospective cohort study and an observational study as well. And data used will be from the clinical records via the Kilimanjaro Cancer Registry, as stated before. And the data from KCR will be inputted into REDCap to be analyzed. And the inclusion criteria that I identified are pediatric patients ages 0 to 19 at diagnosis who came to KCMC in Moshi, Tanzania for cancer treatment in the last 9 years. And then exclusion criteria are patients who are above 19-year-old or were not inputted or are not part of the registry. So first, I want to talk about my first aim. And the key variables that I'm looking at to investigate are kind of broken down into the demographic and clinical variables. So to kind of list them out, the demographic variables that I identified are sex, caregiver, education level, insurance status, region and district of origin, distant travel to KCMC, travel time to KCMC, and then median salary of family, whether the patient was referred from another hospital, level of referring facility, and hospital category of referral. And the clinical variables that I identified are age at diagnosis, stage of cancer care, or sorry, stage of cancer, type of cancer group, location of confirmed diagnosis, intention of treatment, treatment plan, whether the patient abandoned treatment, number of times patient abandoned treatment, date of abandonment, reasons for abandonment, date of death, and then cause of death if the patient were to pass away. And the methodology for AIM-1, the data used will, as I said before, will be clinical records from the registry. And data all will be de-identified and sent to the researchers for analysis, which is me. And the statistical analysis for this AIM will be that baseline of clinical and demographic variables will be summarized overall using descriptive statistics. And then chi-square tests of association will be used in order to test the association between the clinical and demographic variables and the outcome of whether the patient abandoned care, as well as t-tests will be used to test for association for continuous exposure such as age and income with the outcome of whether the patient abandoned care. And we'll also assess for missingness in the data by looking at patterns of missingness across the whole data set. And for those that are missing, we'll use multiple imputation if the levels of missingness are minimal. Okay. And then now for aim two, just to reiterate, my aim two is quantifying out-of-pocket costs for families of patients who were referred out for radiotherapy and investigating whether the family abandoned care. And I kind of drew this picture on the bottom to kind of ground my research question. And the aim was created due to the fact that many patients may not directly go to their radiotherapy unit after referral. Some may, you can see in like the arrows, or I'm not sure if you can see my cursor, but some may go home first, then to DAR, back home, going back and forth throughout their radiotherapy treatment. And some people might go straight to their radiotherapy, go back home, and have this continued process of going back and forth. And then some may go to DAR and stay until their radiotherapy ends. So people have different paths that they may take, and all of this also puts a huge burden on their families. And because of that, some people may abandon their treatment. And so this aim will quantify the out-of-pocket costs for each family and investigate abandonment of care and whether there's also kind of a correlation between these two variables. And we'll look into the total cost it'll save the family if they aren't referred out externally. And this may also help us justify why it's important to have a radiotherapy or for the radiotherapy unit at KCMC to be run, since they have a radiotherapy there unit already to avoid the burden of out-of-pocket expenses for these families. So similarly, the key variables are listed here below, and they are some are very similar, but for demographic variables, it includes like sex, caregiver, education level, insurance status, region and district of origin, distance travel to KCMC, and travel time to KCMC. And then my clinical variables are age at diagnosis, stage of cancer, type of cancer group, location of confirmed diagnosis, location of radiotherapy referral, distance to radiotherapy treatment from home, out-of-pocket expenditures to the radiotherapy treatment, whether the patient abandoned treatment, number of times patient abandoned treatment, referral patterns for radiotherapy, date of death, and then cause of death. So for the methodology for AIM2, similarly, all data will be inputted into REDCap, and out-of-pocket expenses that it costs the family to travel to their radiotherapy per trip, and the distance it takes the patient from home to DAR for radiotherapy will be estimated from expert opinion of the staff for childhood cancer at KCMC and analysis of previous literature out as well. And to calculate the cost that will save the family if they are not referred out externally is the total cost per child that it costs the family to take their child to Dar es Salaam for radiotherapy will be estimated and multiplied by the number of times the child needs to go get their treatment. And kind of logistics of the quantification of these out-of-pocket costs, identifying referral patterns are still something that I'm trying to still figure out. So I also welcome any suggestion if anyone has. And then moving on to the statistical analysis. So similarly, the expenditures will be summarized using descriptive statistics. An association between the out-of-pocket expenditures and whether the patient abandoned care will be analyzed through the regression analysis. And also we will assess for missingness of the data by looking at patterns of missingness across the whole data set. And for those that are missing, we will use multiple imputation if the levels of missingness are minimal. And some ethical considerations. Ethical clearance for this study has been given through the Duke IRB, KCMC, and Tanzania's National Institute for Medical Research. And this study has minimal risk for the participants as there's no intervention included and it is a secondary analysis. But to also minimize risk, all data will be set unidentified from our data analyst Yotam at KCMC. And all data that is online is behind a regulatory body approved firewall, and all electronic files will be password protected that only senior staff have access to. And all data will be reported as well to aggregate or on aggregate level to minimize risk. So in conclusion, from this study, hopefully we will understand risk factors that are associated with abandonment of care from our AIM-1. And there's so little research on abandonment of care, despite it being one of the most preventable causes of childhood cancer treatment failure. And if successful, the results can inform future interventions and also support evidence-based strategies to reduce treatment abandonment. And from our AIM-2, we will have quantified the out-of-pocket expenses associated with radiotherapy referral and how much it may save the families if they are not referred out. And this could also serve as evidence to advocate for a radiotherapy unit at KCMC. And this potentially could relieve many families of the economic and physical burden of being referred out for radiotherapy. Yeah, so thank you guys so much for your time. If anyone has any questions or suggestions, please let me know.
Awesome. Thanks so much, Yuuna. Lots of congrats coming in. Folks, feel free to share comments, questions, or feedback in the chat, or you can unmute to speak. Starting with folks here in the room, any feedback, questions, suggestions for Yuuna?
All right, to Yuuna, I'll start just pointing you to structurally, I think it's pretty straightforward what you're trying to do. The first aim that has a very exploratory design, there's some important concerns around the way you approach the inference question there, and I'm sure you're very well supported to make that discussion. But I've been pushing students to move away from the concept of risk factors, from the perspective that when you get a model with a bunch of predictors and you throw them into an outcome to see what comes out, what sticks, that's more around finding what potential risk factors could be, but you haven't tested for them, because that's not what that design is for, right? You're not finding something that is theoretically linked to that, and then you're testing to see if it's confirming that hypothesis or not. And basically, it could lead to some associations, like one I was just on a thesis committee defense Friday, where receiving treatment for epilepsy was a risk factor for you to have poor school outcomes, which is counterintuitive. And the medication here is a proxy for a variable that was not in the model, which was epilepsy severity. So, of course, those that are more severe have more medication, therefore they are also going worse in school. And there could be a mediating pathway through the medication there, but that variable was not in the data. So thinking through that first aim from a what are the potential causal pathways and how you're adjusting for that, which again, I'm sure you're very well supported to do that. I'm just concerned with the word. And then I would point you to the RDEC has just launched recently a core guide on doing exploratory analysis, which is basically what you're doing. You're getting a bunch of predictors in a cross-sectional design and trying to see what is associated with a potential outcome as a hypothesis generating thing. And there could be some wording there or some guidance for you to read more about this.
I just shared the link for the core guides from RDAC. That's a good point. Yeah. The measurement things, I'm glad that you noted, being kind of open to some feedback, and it's going to be critical to have that, of course, as Emily knows, from the folks on the ground there regarding especially when it comes to the travel, because there's a lot of factors at play there. So I don't have the answer. I'd love to hear from some of the Tanzanians that are with us today, regarding what those are, because I'm sure you can imagine, and you can reference some of the previous published work about, it's going to look a lot different traveling to Dar es Salaam if you own a car versus not, or if you're going by bus versus a private car. I mean, there could be even people in the sample who are taking planes for that trip. So it's gonna vary a lot, and we have to make sure that we're getting everything that could potentially be at hand, because that's one thing that comes to mind first for me. But there's probably other factors that wouldn't even occur to me that some of our local collaborators could point out. So I'm glad you're being thoughtful about that. I don't have the answer, but I hope you keep exploring that.
Those are really important things. So thank you so much for pointing that out.
Other feedback from folks online? Especially you guys in Moshi, anything to share? I see that Edwin, one of our folks at KCMC says, great projects, some feedback. I think aim 2 could be more specific, seems a bit broad. Anything else?
Not here.
Any other concerns or questions that you guys have, Yuuna or Emily? To raise for the group. I also see that William said it would be interesting to have qualitative interviews with those who abandoned care. I think somebody has probably explored that a little bit. I seem to recall. Emily, you want to speak?
Oh, I love that idea. We have
Yeah.
not, we haven't done qualitative interviews. My IRB won't cover that for families who abandoned care, but I definitely think that's such a good next step to getting this quant part down first.
Yep.
Good job, William.
That's a great point.
Yeah.
All right, last call. If not, let's all thank Yuuna for presenting and wish you luck